Hello everyone and welcome back to Medi Notes for Medicos. The topic that we're going to deal today is Hashimoto's thyroiditis from the topic of pathology. The objectives are introduction, the characteristic features, etiopathogenesis, clinical features, the gross features and the histology. So what is Hashimoto's thyroiditis? It is actually an autoimmune chronic lymphocytic thyroiditis which have a high chance to convert into Hodgkin's lymphoma. The other names that is used to define Hashimoto's thyroiditis is diffuse lymphocytic thyroiditis, struma lymphotosa, Goitres autoimmune thyroiditis. The incidence occurs more in females between the age of 30 to 50 years. So there are three characteristic features that would help us to detect Hashimoto's thyroiditis. Number one is diffuse goitrous enlargement of the thyroid. The second is the lymphocytic infiltration of the thyroid gland. And third is the occurrence of the thyroid autoantibodies. When we see the etiopathogenesis, there are five etiopathogenesis basically. One is in association with autoimmune diseases, for example, like Graves' disease, SLE, rheumatoid arthritis, etc. Other is immune destruction of the thyroid cells. It can occur in two ways. One is with the association of CTLA4 and the other is the activation of CD4 plus T helper cells. This causes an infiltration of the CD8 plus T lymphocytic cells which cause immune destruction of the parenchyma. The third is the detection of the autoantibodies. The sera possesses certain autoantibodies. One is thyroid microsomal autoantibodies, thyroglobulin autoantibodies, TSH receptor autoantibodies, thyroid autoantibodies against follicular cell membranes, that is the thyroid hormones itself. The fourth etiopathogenesis is by inhibitory TSH receptor antibodies. Here, it can either behave as hypothyroidism or hyperthyroidism. Now, the genetic bases are it can either be of HLA-DR3 or HLA-DR5 subtypes. So, what are the clinical features a patient having Hashimoto thyroiditis would present themselves with? They would have painless, firm, and moderate goitrous enlargement of the thyroid gland. They would have depression. They would be having fatigue, thick skin, constipation. Along with that, their T3 and T4 level would decrease, RAIU level would decrease, and they would either show hypo or hyperthyroidism. If it is hyperthyroidism, it would be hashimoto'sthyroiditis. Next is the gross features. If you see over here, you can notice that this feature over here is diffuse, symmetric, firm, and they are rubbery enlargement of the thyroid gland. So if you see the cut section, you'll see that the accentuation of the normal ovulation, it's retained back to the normal shape of the gland. And in fibrosing variant, we would be seeing firm enlarged like this, firm enlarged thyroid with a compression of the surrounding tissues. What is the histology that we can see in Hashimoto thyroiditis? We would be seeing that infiltration of the glands would be taken by lymphocytes, plasma cells, and immunoblasts and macrophages, along with the formation of lymphoid follicles having germinal features. This is the lymphoid follicles with germinal center formation. We will be seeing decreased number of thyroid follicles, which are generally atrophic and are often devoid of colloid. We will be seeing follicular epithelial cells known as Hurtl cells. If you can see over here, you can find that Hurtl cells. Uh, these are Hurtl cells. This can be either in sheets or this it can be in a follicle, and they would be having large number of mitochondria and contain large bizarre nuclei. We would be also having slight fibrous thickening of the septa that separates the thyroid lobules. So that was it for today. I hope you like this video. If you like this video, don't forget to like, share and subscribe to the channel. We'll be coming with more videos. Still then, stay tuned. This is Ashna Vira just signing off for today. Bye.